Hi, everyone, and welcome to another webinar in our series, Parenting Children with Special Needs in a New Reality. My name is Aubrey Schmalley. I'm the owner of Sensational Achievements in Stamford, Connecticut. Sorry that the camera's a little bit dark today. I had to use a different computer to broadcast, but I still hope the information is going to be very valuable for you. And by special request, today I am going to be talking a little bit more about how to continue to improve visual skills beyond the basic vision exercises that I have been talking about in our body activated learning program, because it isn't just about getting your vision to guide what your body's doing in space. You then have to continue to refine your visual skills as the writing demands go up in school and as you progress into higher and higher levels of reading. So to give you some idea developmentally of what I'm talking about, think about when a child is very young, they don't actually have a whole lot of distance vision. They just see, mom right in front of their face as they're being fed. Once they start to get a little bit older and they can see a little further, they can see when mom is coming to the crib. And then as they start to get to be crawling and mobile, that's when you start to see more of that distance vision kick in, and you start to see children really start figure out how to use their body in space. And there's a reason that we don't really introduce a lot of focal visual demands until children are older, because their vision really does need to develop in the larger space and the larger environment first, with the support of their vestibular system, before you can start to refine their visual skills. The other thing to consider is that even people who put together readers that are different levels for children keep visual skill development in mind. So a young reader might only have one or two lines on the page and then lots of pictures. And often we talk about just using the pictures to help the child figure out what the words are and start to attach meaning to the words that they're seeing. But what's happening on a visual level is that the font size of the words is actually pretty big. We're looking more at 16 point font for a child to focus their visual attention, and we're only putting a single line of information. And that makes it much easier for the child to focus and learn how to track visually across the page, to start to begin with basic reading. And again, you're starting with single word sight word recognition before you even move to, two or three word phrases. So all of this gets built very, very gradually through the process of reading, or should be built very gradually through the process of reading. But some of our children really don't get those skills to come in for them. And we see this in the kids who really struggle with doing dot to dot. They struggle with coloring. They struggle with basic mazes. They show a lot of difficulty in some of those pre-writing skills really not coming together for them. And you still see their hand, being kind of disconnected from their body. Children on the spectrum, you often see when you're first starting to work on writing or cutting with them, that even if you put their hand on the page, oftentimes their eyes will go the opposite direction. And some of it is actually reflexive. They can't get their eyes and their hands working together. While for some children, it's actually that they really lack the motor intention and they don't really know what you're trying to get them to do. So they're not going to visually orient and attend to something that doesn't make any sense to them. Now, let's talk about how vision is kind of woven into the process of reading and writing, and why we need to look a little bit more deeply when we're trying to figure out what the problem is if a child is struggling with reading and writing skills. So think about the activity that you're asking them to do. It might be that you're asking them to write on a line. It might be that you're asking them to write inside of a boundary or on multiple lined paper. It might be that you're asking them to write from memory or compose a sentence or write down what someone is saying. All of these are different types of writing tasks. So it's really important to identify and separate out the visual deficit from some other processing deficit. If you have trouble translating auditory information into the written word, then your writing is going to be much less legible than when you're copying and the words are right in front of you and very easy for you to see. But if you have trouble with visual attention shifting your eyes up and down, then you're going to struggle to monitor the boundaries and actually copy all the words. So you might skip lines and words, you might lose your place. Your writing may start to kind of go all over the place on the page because your eyes are not keeping up with those visual attention shifting demands. So that's a situation where you know for sure there's something going on in the visual system that's impacting the child's ability to engage in that copying task. But you can't say the same thing when it's auditory to writing, because you're taking out that visual attention shifting demand. Now you're looking to see, are they using their eyes to monitor what they're writing for the quality of the writing? And is there something else getting in the way? Is it an auditory issue? Is it that their spelling is terrible and so the effort of recall is really high? Or is it that they have poor spatial awareness? So when they're trying to organize the information on the page, the sizing and spacing is all over the place. So it's important to ask the question, where is my child having difficulty? Maybe those two conditions are totally fine and your child actually falls apart only when composing. And that's important to know, because then you might be looking more at a cognitive issue or a dyslexia issue where the composition itself is so challenging that the child can't do two things at once. And it might not be so much the vision as it is the act of processing and forming the sentences that's contributing to the legibility. So for today, let's focus on just some of these vision pieces. I'm having trouble copying from the board or copying from a piece of paper. I'm losing my place. I'm not monitoring the boundary. Or maybe when I'm going to do, if I'm a preschooler and I'm doing a dot to dot, or I'm doing a tracing activity, I can't get my eyes to monitor what my hand is doing, and I can't get my eyes to efficiently scan the page so that I can connect all the dots. Now, how are we going to address these kinds of issues, which very likely have a vision link? Maybe you've done all the ball skills I've been telling you about, right? Maybe you've, bounced the ball off the wall, or you've, done the body taps and got your vision to guide what your body's doing. You're doing all the head tipping. That's a fantastic foundation. You've started to build the use of vision in space. But now we need to progress to two-dimensional space, right? Because the second thing that needs to happen is you need to be operating in two-dimensional space to be able to improve your writing and drawing skills. So now what I would do is actually start with more flat surface types of activities. Now you'll notice I'm using a big whiteboard, and that's not just so you can see it in the on the webinar today. It's also because I actually want you to use larger flat surfaces with children first. The reason being, I'm not losing the kinesthetic and spatial element of learning how to draw and learning how to connect my eyes to my body when I go towards a flat surface that is still large enough where I'm crossing midline and I'm having to really kind of move my eyes through space. So little things that you can do on a flat surface like this might be something as simple. Let's see if you guys can see it, the color. Let me get the right color for you. So let's say you pick, let's go with letters for today, right? Like maybe I'm practicing capital letters and lowercase letters. Maybe that's where I'm at in school. And on this side, not in the same order, I'm going to put the lowercase version of that letter. Okay, so let's see, where's my last one? Okay, now the reason that I'm doing this is I'm going to ask the child then to match one side to the other. And you may have seen worksheets that are like this, right? Match the first letter to the animal that's on the other side of the page. Take that same concept and put it in a larger space and then have the child stand in the center, because watch what my arm's gonna do. As long as I'm staying in center and I've got my feet shoulder width apart, then when I connect my letters, I'm still gonna get midline crossing. Okay, and I'm still gonna get visual attention shifting in larger space to be able to complete the task. Okay, and then when I get all of them, now I've taken the left-right attention shifting that I've taught you before in the body activated learning program, where you're just shifting your eyes left and right, and now attaching it to a much more functional task and putting it in two-dimensional space. If I want to work on that same skill, but the problem is actually horizontal visual attention shifting, it really is as simple as rearranging the letters. Okay, so now I'm just going to rearrange the letters or the numbers or whatever it is that I'm working on with the child. Sorry, my markers aren't working so fantastic. Right, and now when I stand on center, I'm getting the same thing, but I'm practicing that up down attention shifting, making sure that I'm looking up at the letter that I need and then looking down and making that connection. Some children will not shift their attention to see where they're going. They will start moving before they actually look for the letter or the number or whatever it is. And then what you're going to see is a little bit of meandering, we'll call it. Okay, they start moving and then they're like, oh yeah, here's my B. Or they'll start going, oh, there's the A. And they'll try to scan as they're moving rather than increase the efficiency of the visual attention shifting, followed by a definite motor plan to make the line straight. So make sure that you're also differentiating between what is a pencil control problem because of lack of fine motor coordination and what is actually a problem with that visual attention shifting and then the motor plan and the motor intention that follows to make the straight line. And an easy trick that I use if I see children who are meandering like this and they just are not shifting their attention is I'll have them tap. So I'll actually take their hand and I'll do capital C, lowercase c, capital C, lowercase c, and then I'll say connect. And almost automatically, I'll see that line get much straighter because now the motor intention is from here to here, not, okay, I know I need to start moving. Oh, wait, there's the letter. Okay, so that's a really easy thing to put together on a big whiteboard. Sometimes I'll even just buy those sticky paper whiteboards that I can just stick on the wall anywhere. If I want to then transition that visual concept, so left, right, up, down, if I want to transition that visual concept into actual shape formation. Now, remember, we're going to do shapes before we get to letters because that also is a natural developmental progression. I might do something like this. And try to get them to practice the upper and lower boundary just by making continuous lines. So there's the top, there's the bottom. But the top's going to change. There's the bottom. The top, bottom, top. So now I'm starting to transition them into line formation and direction changes. But I'm making the boundary a different size and a different height. And the reason I'm doing that is because, again, sometimes things that are static visually, kids kind of try to memorize and then they don't continue to visually attention shift to monitor the upper and lower boundary. So you actually have to put them in a position where they're forced to monitor, because if they don't, it'll create a mismatch and then they overshoot. So the kids that are not visually monitoring, they might go past it, and then you'll start to see that that they really aren't shifting before they're moving, and that's another reason why they've just stopped kind of paying attention to the boundaries on the lined paper to get their words on the page. One thing that you can do, and what I do a lot for kids who have trouble engaging their vision, is I'll use a lot of visual contrast. So if I know that the child is struggling, I might actually make these all different colors just to attract their visual attention to the task that I'm doing. And if I've got 3 different colors, and maybe I can add a little bit of a cognitive element, and I say orange, green, purple, now I'm starting to re-engage that cognitive attention as well as the visual attention by using the visual contrast to support the engagement of the eyes in the process. Now, if you're moving on to, sorry everybody, if you're going to move on to scanning and trying to do things like connect the dots, then it might be important to do a task that, we'll just stick with letters because that's an easy example. Let me change again because I don't think we can see these very well. This is assuming that the child that you're working with knows the alphabet. If they don't, you're going to have to use letters or maybe call out animal stickers or whatever it is that works depending on the child's age. But the same process that we use for shifting left, right, up, and down, we're going to use that to kind of work on some visual scanning skills. So it might be that you have them circle the letter A until they see the letter B. Once they find the letter B, okay, do you see the letter B? They have time to stand in front of their board. They're scanning. When they find it, then they can go down to letter B and circle it while they're looking for letter C, and then go over to letter C. Same thing while I'm looking for letter D, and then over to letter D. So what I'm doing is I'm keeping that connection with the eyes to the hand, and I'm training them to look first, scan their visual field, and then draw the line to connect. So it's less apparent that it's a left, right, up, and down, and more teaching the child how to visually scan the page for information. And you can make this as simple or as complex as you want to. So you may only start with 5 letters or 5 numbers or something like that. And then ideally, if you can progress to the entire alphabet, that's 26 letters or 26 visual points that the child has to find in their visual field that helps to train them how to scan a visual field, filter out the extra information that they don't need just yet, and then make a plan to actually connect the dots or to filter out the extra information and maintain their focus on certain visual points. So the use of this 2-dimensional space in larger space is really critical as the next stepping stone to getting to the smaller visual space. And all of these types of activities that I've shown you in the larger board are things that you are going to be doing on a smaller piece of paper. And you've probably already seen them in workbooks when you're doing tracing, when you're doing dot to dots. Like I said, if you're connecting numbers to sets of information, these concepts are very commonly used in workbooks, but then when a child comes to ROT session, it's really not that useful to just start working with them at the workbook level if they've got a vision problem. If their eyes are not guiding what their body is doing in space, if their eyes are not guiding and shifting their attention, and they've just, kind of just learned what the workbook activities are, you're really not going to make very much progress just practicing the same workbook sheets over and over again, because you want to make sure that whatever the visual deficit is or whatever the visual motor deficit is, you're attacking that, cleaning that up, and then sending them back into the educational environment to be able to utilize that skill to complete a cognitive task. And knowing that there is a visual element and a cognitive demand to the activities that they're doing in the classroom is super important, because if you can tease out that there's actually not a vision deficit, then the reason that the child's legibility isn't improving is likely more on the cognitive level. But if you see the vision issues, if you see that there's a constant disconnect, if you see that they're not visually monitoring what their hand is doing, then it is important to ask the question. And if you're a parent, definitely ask the question, why or what are you doing in the OT session besides just workbook pages to help my child be able to use his vision more effectively, to write on the line, to complete the coloring page, to complete the dot to dot. And those are all really valid questions that are perfectly appropriate to ask in an IEP meeting, and definitely appropriate to ask for goals on. Because if you're just focusing on a goal that says your child will write with attention to, or within, let's say, will write on the baseline 80% of the time, for example, the goal itself is not reflecting the fact that the problem is that the child is not visually monitoring the baseline. If it says will visually attend to the baseline, or will not just anchor their letters to baseline, but will not overshoot the baseline, or whatever the specificity you need in the goal is around your child's vision, ask for it. Because as the IEP follows your child to their next teacher and their next team, having those little details inside of the goals, it actually clues the therapist in to where the problem is with the writing or the visual motor skill that isn't developing, and then actually allows the therapist to develop better treatment strategies, especially if maybe they're not as familiar to looking for the nuances in why a child is struggling with visual motor or handwriting skills. So as we progress to smaller spaces, we might move, from doing these visual monitoring tasks, we might actually move towards utilizing boundaries. Right, let's say we have 2-inch line paper, 3-inch line paper, and then practice going high and going low. And they would copy the motor plan of these mountains, but with specific attention to the lines and which boundary they have to pay attention to. Now, why would you do this with a kid who already knows all the letters and knows how to write? The answer is because they already know all the letters and know how to write. And if you're pretty good at writing your signature, how many of you actually look at your signature as you're writing it? Not very many. And why is that? Because you've internalized those motor plans. You don't actually have to think about your signature, and you probably don't write it that neatly anyway when you are writing it out on a piece of paper. So some children start writing as though it's their signature, and they just feel their way through the letters. And if they have an underlying vision problem that never got cleaned up, yet they have good kinesthetic awareness, they have good fine motor control, things like that, there's no reason to look. And their legibility is never going to improve. But if you put them in situations where you actually take out the letters, then you can train the vision separately to re-engage and start to pay attention to the boundaries. And then instead of just going back to words after you do things like this, what I would say is purposely put these back in here. Purposely make nonsense words. When they're doing speech testing, they always test nonsense words because they're looking at some of your decoding ability, right? And your ability to kind of tune in and discriminate letter sounds. In our case, we still want a child to discriminate the letters, but we're choosing letters that have different orientations to the baseline into the ceiling, right? So I might pick a short letter, and then a letter that, and then a tall letter, and then one that falls below the baseline, and a letter that starts at the center. And I'm doing this because now with each letter, I've taken out the reading component. So even if I have a good reader that's going to be like, oh yeah, that's the word dog, and then they just start writing it kinesthetically and they don't look, if I don't put a word on there, then I circumvent their ability to use their other cognitive strengths to override where the vision deficit is. So as I choose these letters, I'm getting them to purposely focus on, does it start in the middle? Does it start at the top? Does it fall below the baseline? And when I've got these visual skills kind of trained back in, and I've not let them just think around the problem, especially if it's a child that's a good reader and a good speller, now when they go back to class, I've already helped them find ways to re-engage their vision to help clean up some of that legibility. So today, we've really talked about visual attention shifting, boundary monitoring, how to go from larger space to flat space to space on the table, and that visual progression. There's so much more to talk about in vision, but I only have 30 minutes today. So that is all of the soundbite that you're going to get from me. More to come in the future for sure, because there's so much to learn and understand. And for me, I'm fascinated by vision, but I'm also fascinated with figuring out the puzzle as to why a child is not making progress in writing just because you're practicing fine motor, just because you're practicing tracing, just because you're practicing completing the workbook. All of those things are great, but I have to tease out where the problem is. And if the problem is in the visual domain, and I can figure out what the problem is in terms of visual scanning, attention shifting, monitoring, then I can make my intervention much more detailed. And I can also help you work smarter, not harder, when you're trying to support these skills at home with your child. Because the chances are that the workbook is not changing, the workload and the academic tasks are not changing, but you as a parent can start to implement some warm-ups and some different activities that are going to help your child progress and then be able to do the homework and the academic work more effectively. Now, I have 1 minute left, but before I go, I wanted to tell everyone some exciting news. I am on Saturday going to be running my first live body activated learning certification training as a pilot program for some parents and professionals in Stamford, Connecticut. And hopefully that will grow into very soon an online level 1 certification program, which means that you as a parent, or you as a paraeducator, or you as a non-OT or a non-motor type therapist can have a basic understanding of the value of body activated learning, the different elements of body activated learning, especially the ones that we've been talking about on the webinar, and how to utilize those skills no matter what community setting you're working in, whether it's a school or you're a nanny in someone's home, when you have children in your space that are neurologically diverse. And that is a norm rather than the exception these days. So as a non-licensed professional, as just a parent, or even as a babysitter or a teen that volunteers at some sort of after-school program, any of that, those are great spaces to have some knowledge of how to work with children with diverse needs and implement the concepts of the body activated learning framework when you're interacting with them, and when you're helping them interact with their peers, because it's something that is helpful to everyone, not just the special needs population. Now, the other exciting thing I want to mention is that on the 21st, I am reopening my parent coaching program for the fall. So any parent who really wants to join our community program to get support from other parents online, to be able to learn strategies to save yourself first so you can show up better as a parent, coach with confidence through all these tools and tricks that we are utilizing in this process, and succeed with screen time, because virtual learning is going to become part of our new reality. And finally, to connect and collaborate with your children to build that therapeutic alliance, to build an interaction style that's going to help empower them to succeed rather than just get them through the school day. So all of those things are part of the coaching program. And if you are like me and you are a parent that's either in a hybrid model or going to be doing homeschooling this year, or at least for the next 6 months, it would be so fantastic if you joined this group and became part of a community of parents that is looking for support and solutions on how to help their children perform better in school, feel more empowered, feel more successful, and have less meltdowns, so that they really see the results of their own efforts, and they see that you're on their team, you're that person in their life that believes in them and that really helps them succeed and gives them new strategies, because you have put yourself in a better place and you've learned the strategies for yourself that you can also utilize with your children. So thank you so much for coming today. I think I have one question, so give me 1 second and see if I can start. No, all right, just kidding. Thank you so much for coming today. I really hope you learned a lot. I will continue my vision activities, maybe not every week, but I'll continue to throw them in because there are so many more things to talk about when it comes to writing. And feel free to throw in any questions that you have in the comments in the Facebook group. And if there's some additional things that I can talk about in future videos, please let me know. Or you have a specific concern that you've seen with your child and their handwriting, or questions about why legibility might not be improving, or even if you want to take a snapshot of your child's writing and throw it in the group, I'm happy to give you my 2 cents on just what I see as a visual example of what seems. I don't guarantee perfection, and I don't guarantee I'm going to be right on the first try, because if I can't ask you extra questions, then I may not have all the answers, but I will do my best. And I'm certainly happy to engage with you on social media, try to give you some guidance, and please keep your eyes open for the certification program and for the parent coaching program reopening on the 21st. And that is going to come with a live webinar to help you implement the 6-step guide to optimizing your child's sensory diet. Have a great day, and I will see you next Wednesday.